Endodontic retreatment decision-making, the influence of the framing effect done by Dr. Kvist in 2023. Epidemiological studies have reported a prevalence of periapical radiolucencies in root-filled teeth of between 12% and 72%. Apical periodontitis in association with the root-filled tooth is defined as an endodontic failure and thus implies a clinical decision in action. The present study was set up to explore the possible influence of a framing effect when an individual is asked to choose between no intervention and retreatment of a root-filled tooth presenting with asymptomatic apical periodontitis. A total of 248 individuals divided between dental students and workers agreed to participate in two variants of questionnaire that were created, each designed to cause a respondent to answer from their own perspective as a potential patient. The description of the clinical decision-making situation was simple and patient-oriented. Although the clinical situation was identical in both questionnaires, the two alternative treatment options were systematically framed in two different ways. The clinical situation was described as follows. Imagine that 5 years ago you were involved in a bicycle accident in which you injured your upper left central tooth. As a result, the tooth needed root canal treatment, opened up, cleaned from bacteria, and filled with a rubber-like material, and it's sealed with a plastic filling. Since that, you have not experienced any problem. In a regular routine checkup, your dentist decided to take a radiograph of the tooth, which shows a lesion in the bone around the tip of the tooth, inadequate root canal filling with a lot of voids. So your dentist presents with two options. You have free dental care, so any treatment you choose is free of charge. It's either you refine from the retreatment now and wait and see, and the chance that the tooth will be asymptomatic for the rest of your life is approximately 90%, and the chance that remaining infection will have no negative effect on your overall health is more than 99%. Or to retreat as an option B, which involves remaking the root canal treatment. So despite this retreatment, the risk that the inflammation will not heal is approximately 25%. For the second questionnaire, the intention was to frame the option in favor for the retreatment. So for the option 1, the risk that the tooth later will become symptomatic in form of pain or swelling is approximately 10%, and any remaining infection will have a negative effect on the overall health is less than 1%. For option B is to retreat this tooth, and the chance that the inflammation will heal is approximately 75%. So, in the overall results of those 248 practitioners, 56.9% choose to retreat and 43.1% chose to wait and see. For those who had received the first questionnaire, 55.2% choose the option to refine and wait, and 44.8% choose to retreat. Although who received the second questionnaire, 30% choose to wait and see, and 69.1% choose to retreat. So in a conclusion for this paper, a framing effect is likely to play an essential role in endodontic retreatment decision-making of root-filled teeth with asymptomatic apical periodontitis.